Hello, Dr. Williams again. Listen, this time I want to talk to you a little bit about some of the nutritional issues related to mental illness. Few people are aware of the connection between nutrition and depression. While they easily understand the connection between nutritional deficiencies and physical illness, depression is more typically thought of as strictly biochemically based or emotionally rooted type of a problem. On the contrary, nutrition can play a key role in the onset as well as the severity and duration of depression. Many of the easily noticeable food patterns that people engage in are the same as those that occur during depression. These include poor appetite, skipping meals, and a dominant desire for sweet foods. Nutritional neuroscience is an emergent discipline shedding light on the fact that nutritional factors are connected to human cognition, behavior, and emotions. The most common mental disorders are depression, bipolar disorder, schizophrenia, and obsessive-compulsive disorder. The dietary intake pattern of the general population of many Asian and American countries reflects that they are often deficient in many nutrients, especially essential vitamins, minerals, and omega-3 fatty acids. A notable feature of the diets of patients suffering from mental disorders is a deficiency in these nutrients. Studies have indicated that daily supplements of vital nutrients are often effective in reducing patients' symptoms. Supplements containing amino acids have also been found to reduce symptoms as they are converted to neurotransmitters, which in turn alleviate depression and other mental health problems. These may be appropriate for controlling to some extent, preventing depression, bipolar disorder, schizophrenia, eating disorders, and anxiety disorders, attention deficit hyperactivity disorder, autism, and addiction. Now, here's the thing. Most prescription drugs, including common antidepressants, lead to side effects that usually causes patients to skip taking their medications. An alternate and effective way to overcome noncompliance with psychotropic medications is to become familiar with alternative or complementary nutritional therapies. When we take a close look at the diet of depressed people, an interesting observation is that their nutrition is far from adequate. They make poor food choices and select foods that actually contribute to depression. Recent evidence suggests a link between low levels of serotonin and suicide. It is implicated that lower levels of this neurotransmitter, in part, lead to an overall insensitivity to future consequences, triggering risky, impulsive, and aggressive behaviors, which may culminate in suicide. Depression is a disorder associated with major symptoms such as increased sadness, anxiety, loss of appetite, depressed mood, and a loss of interest in pleasurable activities. Patients who are suffering from depression exhibit suicidal tendencies to a larger degree and hence are usually treated with antidepressants and/or psychotherapy. Deficiencies in neurotransmitters such as serotonin, dopamine, noradrenaline, and Y-amybutyric acid, or GABA, G-A-B-A, are often associated with depression. As reported in several studies, the amino acids are often helpful in treating depression. This implies restoring serotonin levels lead to diminished depression. The most common nutritional deficiencies seen in patients with mental disorders are of omega-3 fatty acids, B vitamins, minerals, and amino acids that are precursors to neurotransmitters. Studies indicate a link between high fish consumption and low incidence of mental disorders. This lower incidence rate being the direct result of omega-3 fatty acid intake. 1 to 2 grams of omega-3 fatty acids taken daily is the generally accepted dose for healthy individuals. But for patients with mental disorders, up to 9.6 grams has been shown to be safe and effective. Now, here are some of the things you need to stay mentally healthy. Carbohydrates. Consumption of diets low in carbohydrate tends to lead to depression, since the production of brain chemicals such as serotonin that promote the feeling of well-being is triggered by carbohydrate-rich foods. Another thing that you need to include in your diet to stay mentally healthy are proteins. Proteins are made up of amino acids and are important building blocks of life. As many as 12 amino acids are manufactured in the body itself, and the remaining 8 essential amino acids have to be supplied through diet. A high-quality protein diet contains all essential amino acids. Foods rich in quality protein include meats, milk, and other dairy products, and eggs. Protein intake and, in turn, the individual amino acids can affect the brain functioning and mental health. Now, there's another thing that you have to take into consideration, in order to stay emotionally and psychologically healthy, and that is vitamins. B-complex vitamins are essential. Nutrition and depression are undeniably linked, as suggested by the mounting evidence by researchers in neuropsychiatry. According to a study, supplementation of 9 vitamins 10 times in excess of normal recommended daily allowance for 1 year improved the mood in both men and women. Minerals. This is another thing that you need to stay mentally healthy and physically healthy, for that matter. Chromium. Many studies on the association of chromium in human depression have been recorded, which indicate the significance of this in mental health. Iodine. Iodine plays an important role in mental health. The iodine provided by thyroid hormone ensures the energy metabolism of the cerebral cells. That's the brain. During pregnancy, the dietary reduction of iodine induces severe cerebral dysfunction, eventually leading to cretinism. This is a disorder causing severely stunted physical and mental growth of a child because of the mother's hypothyroidism. So, in other words, if the mother has hypothyroidism, then there's going to be a deficiency in what the child needs in order to be healthy. Iron. Iron is necessary to produce energy in the brain and for the synthesis of neurotransmitters and myelin. This is the covering of the brain, kind of protects the brain. Iron deficiency is found in children with attention deficit hyperactivity disorder. Iron concentrations in the umbilical artery are critical during the development of the fetus and in relation with the IQ in the child. Infantile anemia, which is associated with iron deficiency, is associated with disturbances in the development of cognitive functions. Research findings pointed out that twice as many women as men are clinically depressed. This gender difference starts in adolescence and becomes more pronounced among a married woman aged, say, like 25 to 45 with children. Furthermore, women of childbearing age experience more depression than during other times in their lives. These indicate the possible importance of iron in the etiology or the beginning or the source of depression, since its deficiency is known to cause fatigue and depression. Iron deficiency anemia is associated, for instance, with apathy, depression, and rapid fatigue when exercising. Okay, now I know that's a little complicated, and it might be difficult to digest. But what we're saying here is that you do not necessarily have to be completely dependent on drugs in order to treat depression and other mental illnesses. You can look at your diet. So one of the things that a person might want to do is have their physician evaluate them and see if they are deficient in any of these essential vitamins and iron and other things that I've just mentioned, in their system, and that way they can supplement it and perhaps even get over their mental illness and their depression without the drugs. I'm not saying that I'm against drugs. What I am saying is use drugs as the last resort, not the first resort. Thank you very much.